The history of cannabis goes back as far as 12,000 years. Cannabis came to the United States at the beginning of the 20th century. It arrived in the southwest United States from Mexico, with immigrants fleeing that country during the Mexican Revolution of 1910 to 1911. For the most part, it was widely used for medicine and spiritual purposes.
Marijuana consists of the leaves and flowering plants of the plant Cannabis sativa. It usually is smoked as joints, reefers, or using other various smoking pieces. Edibles has become an alternative way of receiving the high. It is commonly used in cookies, brownies, or tea. Marijuana cigarettes contain 1 to 3% THC, but more potent varieties may contain up to 15% THC. Hashish contains 3 to 6%, and hashish oil 30 to 50%. Toxicity is dose-related, but there is much individual variability, influenced in part by prior experience and degree of tolerance.
In 2014, 4.176 million people in the U.S. abused or were dependent on marijuana. 138,000 voluntarily sought treatment for their marijuana use. Of adults 26 or older who used marijuana before age 15, 62% of them went on to use cocaine at some point in their lives. 9% went on to use heroin at least once. And 54% made some non-medical use of mind-altering prescription drugs. Nearly half, or 49% of Americans, say they have tried marijuana.
Medical cannabis specialist Dr. Todd Mercuria has recorded over 200 separate indications or uses for medical cannabis. These can be broken down into the following broad categories: anti-nausea, appetite stimulant, antispasmodic and anticonvulsant, pain relief, anti-inflammatory, anxiety relief and antidepressant, harm reduction substitute for alcohol, opiates, and other dangerous drugs.
Most recreational uses of marijuana are not monitored, therefore resulting in the following: increased blood pressure, paranoia, possible allergic reactions. It has the possibility of being laced, and it has long-term mood and anxiety disorders.
When 54-year-old wife and mother Sharon Kelly began experiencing sharp pains on the left side of her body near her ribs, she thought it was a result of a strong massage she had some time earlier, and failed to give it much thought. After several days had passed and the pain failed to subside, she began to think she might be suffering from something more serious, and as it turns out, she was right. Only a few days after noticing the pain, Kelly was diagnosed with non-small cell lung cancer, and in the weeks to come, her prognosis only worsened. Kelly was told that the cancer in her body had made its way to her lymph nodes and the lining of her stomach, and that she could expect to survive for somewhere between 6 and 9 months. After hearing the news, she researched cancer patients who had found relief from cannabis oil, an alternative treatment method used by many chronic disease sufferers. With nothing left to lose, Kelly decided to try it for herself, and began taking a small dose orally several times a day. After noting how tired she became after taking the oil orally, she began researching cannabis suppositories, or drug administration systems that are inserted into the rectum, vagina, and urethra. She found that this method didn't make her tired, and that it allowed her to take the full recommended dose without complication. After several months of cannabis oil treatment, Kelly's scans indicated she was completely cancer-free, shocking her oncologist and others familiar with her case. Now, 13 months after her initial diagnosis, Kelly remains cancer-free and credits the use of cannabis oil for not only her otherwise unexplained recovery, but also her ability to live out the rest of her life with the love and comfort of her family.
Jimmy is a 15-year-old boy in his sophomore year of high school. He's realized in high school in order to fit in, he needed to be a part of the trend and smoke weed with his friends. He thought it was all fun and games until one day, when they went out to their usual spot to go smoke, the friend brought out a bag of cocaine and peer pressured him into it. Now, being a senior, he has lost his plan to attend college because cocaine has taken over his life.
In the United States, 26 states and the District of Columbia currently have laws legalizing marijuana in some form. 3 other states will soon join them after recently passing measures permitting use of medical marijuana. 7 states and the District of Columbia have adopted more expansive laws legalizing marijuana for recreational use. Most recently, California, Massachusetts, Maine, and Nevada all passed measures in November legalizing recreational marijuana. Marijuana has many contradictory facts whether or not it benefits or harms oneself. More and more states are passing laws to legalize it, but ultimately the decision is up to you.